Welcome, DC Dental Society members. I'm Kurt Gallagher, your Executive Director. We created this short webinar series to ensure that members are aware of all the benefits that DCDS offers to them so they can take advantage of those benefits. This session is intended to be interactive, so please feel free to ask questions of our presenters. If you're not speaking, we ask that you mute yourself so that there's no background noise that comes through that may be disruptive to the presentation. The ADA and the DCDS have established partnerships with companies offering a broad range of products and services. You and your practice can save hundreds and even thousands of dollars by using special pricing and services offered by partner companies. Visit dcdental.org for more information on our partners. Today's guest is Shane Sarant from Alternative Solutions, who's going to talk with you about a really important topic, and that's cybersecurity. Shane is going to offer 3 tips that can help your practice today to make them more secure and to reduce the risk of cybersecurity attacks or cybersecurity breaches. So with that, Shane, I'll turn it over to you. Thank you for joining us today, and you have the floor.
Thanks for having me, Kurt, and thanks for the introduction. Again, my name is Shane Sarant. I'm the managing partner at Alternative Systems. We're one of the DC area's leading IT support vendors. We're also a proud sponsor of the DC Dental Society. One of the things that we pride ourselves on is that we try to make sure that you do the dentistry and we'll do the technology. Our job is to have you focus on patient care and not worry about technology, as we'll take care of all of those things for you. Today, we're going to talk about 3 simple things to protect your practice from cyber attacks. And we're going to just jump right into it during this quick session. So the first thing we want to talk about today is passwords. Everyone's favorite topic. Everyone loves them so much because we have to have them in order to remain secure. So passwords is one of the focal points of protecting your practice from cyber attacks. The first thing that we want people to recognize is that we would like practices to stop saving passwords in the web browser. There's a lot of people that use Chrome and Edge and save the passwords in the actual web browser. And while that is convenient, it's not the most secure. There are a number of different password managers out there, from Keeper Security to LastPass to 1Password. Using those type of tools to allow you to store more complex passwords inside of a vault is more beneficial for your practice than saving them in the password browsers. What we've seen is that a number of practices, when they get breached, is usually because the passwords to critical information is stored in those password browsers. So we suggest using a password manager. We provide those free of charge to all of our clients. If you're not using one right now, I'd reach out to your IT provider and see if they can help you get into one. One of the things that the password managers do is it prevents you from using the same passwords over and over. A lot of people try to remember, 1 or 2 or 3 different passwords, which it's great, but what that does is it makes you a little bit more vulnerable to attacks. The password managers allow you to create strong passwords, and you only pretty much need to remember 1 password, which is the password to get into the password manager. Most of today's password managers have access on your phone, as well as your computer, so you'll always have access to what those passwords are, and you should be able to log in from anywhere on any device. And the last thing I want to talk about with passwords is making sure that everyone in your staff has a unique password to log into the computers in your office. A number of practices that we've worked with in the past try to use 1 username and 1 password for staff to log into machines, and then to access the dental software, they may have individual passwords. One of the things that we've seen in some of our forensic research is that former employees and hackers tend to seem to get into these machines based on using the same username and password that most people are using. So we suggest that every individual has their own individual password that you can control and reset on your network. This will prevent you from having um, easier ways for hackers to get into your environment and accessing your network. Second thing that we want to talk about today is backups. Most every practice is backing up their data. One of the things we want to talk about today is making sure that you're testing your backups. Most people are backing up their servers. We also want to recommend that you back up your most critical workstations. This would be your machine in your office if you have QuickBooks, or if you have a PAN machine or a CBCT machine that's connected to your network as well. Those machines are also critical for you to back up as well. So we want to make sure that you're backing up not just your server, but those critical workstations. And we recommend that you back up those machines both locally and remotely. The most important thing, like I mentioned before, is to test your backups. Just because you're backing up doesn't mean that the backups will work when you need it. I would say that 40% of the time that we've been called in to help practices recover is because they can't get any data from the backups, because the backups are either corrupt or are not working to the way that they need to. So one of the things that we recommend most practices do is work with your IT provider to test your backups. Do a disaster recovery plan and test these backups at least twice a year. Have your IT provider work with you on a weekend, come into your office, power down your server, and then see how long it takes to recover from the backups. You want to know how long it's going to take you. You also want to confirm that you can see the most recent data from that backup. So if you're doing this on the weekend and you've seen patients on Friday, you want to make sure that you've seen all the schedules from Friday, all the payments that are posted from Friday, all of those things. You want to just verify that all of those things are working. We do that with our clients twice a year. I recommend you do the same with your current IT provider as well. The third and final thing that I want to talk to you about is cybersecurity insurance. Cybersecurity insurance is becoming more valuable to your practice than your malpractice insurance. You're going to probably use it before you even use your malpractice insurance. If you don't have cybersecurity insurance right now, you should work with your insurance professional to make sure that you do have cybersecurity insurance. This year, we've helped approximately 16 practices recover from cyber attacks. And the average cost of recovery for just the IT portion averages out to about $57,650. This is typically covered by the cybersecurity insurance, but this is just the IT portion. This is not the lawyers that need to be involved. This is not any kind of credit monitoring or anything of that nature that you might have to add on to recover from. So this is just the IT portion, cost roughly about over $50,000. And if you don't have cybersecurity insurance, this is cost that you'll have to pull out of your pocket. So make sure that you are getting cybersecurity insurance from your providers. We are here to help you review the policies and things of that nature. One of the last things with regard to cybersecurity insurance is that we want to make sure that you're adhering to all of the requirements in the policy. So a lot of people get these forms from their insurance providers and they just click yes to everything that they're doing, everything that they're supposed to. We've seen that insurance providers will come back and ask for verification and deny claims if you're not. So work with your insurance provider, work with your IT provider to make sure that you are adhering to all the requirements in the policy. And some of them are quite extensive in terms of what they're requiring. But again, your IT professional should be very familiar with those things and your environment to be able to assist you with those things. If you have any questions, I'm here to answer them.
Do we have any questions from any of the attendees? Shane, I guess I'll throw you a couple, I guess, softball questions. As you were
Sure.
talking about the password vaults, I think that's a great tip. And I struggle with trying to create unique passwords as well. And passwords are long enough. Most of my passwords are saved on my phone in the sort of passwords, I guess, vault there.
Yes.
Number one, is that something that's a technique that is okay, maybe not ideal? It's not as easy as having a vault that's on the computer, but it is a way to sort of have them in a place that is in theory secure.
It is more secure than saving them in your browser. I will tell you that. I think that Apple's done a good job and Google's done a good job on the Android platforms to save the passwords in a very secure manner. Probably not as secure as using one of the more modern, up-to-date password vaults that are out there, like Keeper and LastPass and 1Password. All of those things have applications, free applications on your phone that will give you virtually the same access to those passwords. And it will also help you create secure passwords that are very, very hard to hack. They're very, very inexpensive. We provide them at no cost to all of our clients. But if you wanted to buy one for yourself, they can run anywhere from $2 to maybe $5 a month. And they're very, very inexpensive, and they do a wonderful job at protecting you from using multiple passwords multiple times.
That's helpful. And how about the idea of turning on two-factor authentication? Is that something that you recommended standard as well?
I recommend two-factor authentication for everything that is possible. I know people have issues with having to log in with the password and then potentially having to do something on your phone, but two-factor is going to become the standard probably in the next year and a half. Everything that you log into will be that way. Even your workstation and your computer that you're logging into, you're going to have to log in with two-factor pretty soon.
That's helpful, Shane. I appreciate that. And any questions from attendees? I don't know if my questions might be triggered a thought for someone. Well, Shane, thank you again. We really appreciate your support and the support of Alternative Systems. You've been a strong supporter of DC Dental Society, and we appreciate that. Everyone, please express our appreciation to Shane Sarant for joining us today. We have one more webinar in this series that will be scheduled for this evening at 6 p.m. where we'll hear from Best Card about reducing your credit card processing overhead. And then we'll return in September with our monthly meetings. The next meeting will be virtual on Thursday, September 14th. Dr. Christopher Pescatori will provide an update on digital dentistry. And then we'll also have a bylaws amendment vote during that meeting. So I hope that we'll have a good turnout that we can approve this proposed bylaws amendment. And then we'll return with in-person events in October. Tuesday, October 10th is the first in-person meeting for the fall. So everyone, have a good day and enjoy the rest of your summer. Thank you again, Shane. Take care.
Take care.